Hello and welcome to the American Lung Association's Ask, Advise, Refer, Pregnancy and Tobacco Cessation Training. This training will do an overview of the Ask, Advise, Refer model, discuss the best practice questions to ask your patients, the effects of tobacco, secondhand smoke and thirdhand smoke, as well as various referral methods that are available through the Pennsylvania Free Quit Line. To receive continuing education credit for the Ask, Advise, Refer, Pregnancy and Tobacco Cessation Training, participants must complete the entirety of the webinar. No partial credit will be awarded. Successful completion requires participants to submit a completed evaluation form at the end of the event to receive credit. There is not a minimum score that is required to receive credit. The starting date for this ongoing activity is February 3, 2020, and will end on June 30, 2020. So what is Ask, Advise, Refer? The Ask, Advise, Refer model is a brief intervention that asks every patient at every visit about tobacco use and documents their responses in their medical record, advises patients that quitting matters, and automatically refers all current tobacco users to the Pennsylvania Free Quit Line, unless the patient states otherwise. So what are the best practice questions to ask our patients? It's important that you ask every patient at every visit about tobacco use. You want to make sure you ask not only if the patient is a current tobacco user, but also if they might have been a former user or never a tobacco user. This allows us to gauge past behaviors and possibly address a relapse in tobacco use. The next key question to ask is what kind of tobacco an individual used or uses, and how often. For example, many individuals do not know that e-cigarettes contain nicotine, and therefore it's important that we directly ask if their no tobacco use includes e-cigarettes. The next few slides contain a few sample questions, possible answers, and follow-up questions that are commonly used when practicing AAR. By asking every patient, when was the last time you used a tobacco product, we can determine what stage of quit they are in. For example, if they quit 10 years ago, they're less likely to relapse than someone who quit a few weeks ago. By responding this way, we're ensuring every patient understands that e-cigarettes are tobacco products. We would want to know if they use e-cigarettes so we can provide the proper resources to help them quit. Now that we have reviewed the best questions to ask your patient regarding tobacco, let's see what you remember. How often should you ask a patient about their tobacco use? The answer is, it's important that you ask every patient at every visit about their tobacco use. You want to make sure you ask not only if the patient is a current tobacco user, but also if they might have been a former user or never a tobacco user. Once you ask the tobacco use questions, it's important to then advise patients on the importance of quitting. We want to advise every tobacco user to quit. Advise those who've tried and failed to keep trying and not give up. We also want to employ the teachable moment, and we do this by linking positive benefits of quitting to their tobacco-related condition. For example, if an individual is pregnant, explaining the positive health benefits quitting smoking can have on her, as well as her baby, may motivate the individual to make a quit attempt. It's also important to advise clear, non-judgmental, and personalized suggestions for quitting. And lastly, and most importantly, advise use of both counseling and medication to quit, as this is a CDC best practice. We want to highlight the teachable moment. This moment will give you the opportunity to link existing health conditions or possibly the reason for the visit to tobacco use. It provides an opportunity to discuss tobacco use and link health benefits of quitting to their current health condition. As practitioners, you may initially want to share the physical benefits of quitting. You also want to share the social and financial benefits of quitting as well. We do this because everyone will have a different motivator to quit. Now that we have reviewed the advise portion of the Ask, Advise, Refer model, let's put your memory to the test. True or false, when advising a patient to quit, you should suggest that they use only medication to assist in their quit journey. The answer is false. It's important to advise the use of both counseling and medication to quit. This is outlined in the U.S. Department of Health and Human Services Clinical Practice Guideline, Treating Tobacco Use and Dependence, 2008 update, and is supported as a best practice by the CDC, as well as other leading agencies, including the Lung Association. A combination of both cessation counseling plus medication and nicotine replacement therapy, NRT, is a best practice for going smoke-free. We know from our own metrics that approximately 60% of smokers succeed in quitting tobacco when our Freedom from Smoking program is paired with the use of NRT, compared to only 13 to 17% of those who are successful going it alone with counseling only. The next few slides will provide you with education on tobacco use and pregnancy, as well as secondhand smoke and third-hand smoke. When advising pregnant tobacco users to quit, you can tell them that when they stop smoking, your baby gets more oxygen, even after just one day. Your baby will grow better. Your baby is less likely to be born too early. You'll have more energy and breathe more easily. You'll be less likely to develop smoking-related diseases. Protecting them from secondhand smoke will result in fewer coughs and chest colds, lower risk for lung problems, fewer ear infections, fewer asthma attacks. So, what is secondhand smoke? Secondhand smoke is smoke being inhaled involuntarily when others are smoking in the vicinity. Who is exposed to secondhand smoke? Just like people, pets who live with smokers are more likely to experience symptoms of respiratory disease. Pets usually groom by licking their fur. If the fur is coated with smoke residue, they ingest carcinogens and toxins on top of what their lungs take in. Exposure to secondhand smoke during pregnancy can put both mother and baby at risk. Some of the health conditions associated with being exposed to secondhand smoke are a miscarriage, low birth weight, early birth, learning or behavioral deficiencies in your child, and sudden infant death syndrome, SIDS. Secondhand smoke causes numerous health problems in infants and children, including more frequent and severe asthma attacks, respiratory infections, ear infections, and SIDS. How toxic is cigarette smoke? Secondhand smoke contains more than 7,000 chemicals. At least 69 of these are known to cause cancer, and many are poisonous. Secondhand smoke is a serious health threat and a significant cause of disease and death. Here are a few of the chemicals that are in secondhand smoke and other places they are found. What is third-hand smoke? Third-hand smoke occurs when tobacco smoke leaves residual nicotine and other chemicals on indoor surfaces, skin, fur, and furniture, even after the air has cleared. Who is exposed? Children have increased exposure to third-hand smoke due to their tendency to mouth objects and touch affected surfaces. Pets usually groom by licking their fur. If that fur is coated with smoke residue, they ingest carcinogens and toxins on top of the ones their lungs take in. What are the facts? People may not consider third-hand smoke when they decide to smoke indoors, but the risk of exposure is real. Third-hand smoke residue can remain for weeks, months, or years. It contains more than 250 chemicals. There is no safe level of exposure to tobacco smoke. Smoking in front of an open window does not prevent third-hand smoke exposure. Do you know the 3 R's of third-hand smoke? Remains on surfaces and in dust. Re-emits back into the gas phase. Reacts with other chemicals in the environment to make new chemicals. This is important information to remember when educating your patients. Now that we have reviewed tobacco use in pregnancy, secondhand smoke, and third-hand smoke, we have a few questions to test your knowledge. Our first question is, when advising pregnant tobacco smokers to quit tobacco, what is one thing that will occur when they stop? Your answer could have been any of the following. Your baby gets more oxygen, even after just 1 day. Your baby will grow better. Your baby is less likely to be born too early. You'll have more energy and breathe more easily. You will be less likely to develop smoking-related diseases. Our second question is, what are 2 chemicals that can be found in secondhand smoke? Your answer could have been any of the following. Acetone, found in nail polish remover. Acetic acid, an ingredient in hair dye. Ammonia, a common household cleaner. Arsenic, used in rat poison. Benzene, found in rubber cement. Butane, used in lighter fluid. Cadmium, active component in battery acid. Carbon monoxide, released in car exhaust fumes. Formaldehyde, embalming fluid. Lead, used in batteries. Methanol, a main component in rocket fuel. Nicotine, used as insecticide. Tar, material for paving roads. Our third question is, what are the 3 R's of third-hand smoke? Your answer is remain on surfaces and in dust, re-emit back into the gas phase, react with other chemicals in the environment to make new chemicals. We will now review the various referral methods and how to present them to your patients. There are numerous programs and resources that you can refer your patients to that will help with their quit journey. In this training, we will be specifically reviewing the Pennsylvania Free Quit Line. If the patient is not willing to make a quit attempt, tell them you understand quitting is difficult. Let them know you are always happy to answer any questions they may have. We will now review the Pennsylvania Free Quit Line and the resources that are available to all Pennsylvania residents. The Division of Tobacco Prevention and Control has partnered with National Jewish Health to provide the Pennsylvania Free Quit Line and smoking cessation services to all Pennsylvanians 24 hours a day, 7 days a week. The Pennsylvania Free Quit Line offers up to 5 coaching sessions by phone, with frequency, call dates, and times coordinated by coach and participant. Unlimited calls to the Pennsylvania Free Quit Line as needed. Educational materials on quitting tobacco use. Free nicotine replacement therapy for qualified callers. Up to 8 weeks of patches. A limited supply of no-cost quit medications, such as patches, lozenges, gum, varenicline, and bupropion, may be available through the program. Patients may also be able to obtain some of these quit medications at no cost through their health plan. Referrals to regional primary contractors for additional services. Services in both Spanish and English. The Quit Line provides 3 different quit programs. We design them to meet individual patients' style of communication and the support they're seeking as they quit tobacco. All quit programs will help patients deal with the emotional, behavioral, and physical aspects that make quitting so hard. Phone and online. Coaching over the phone, plus email, text, chat, web-based materials, and quit progress tracking through our website. Phone only. Coaching over the phone, plus materials, quit planning, and quit progress tracking. Online only. Materials, quit planning, and quit progress tracking through our website. See more at pa.quitlogics.org. There are various ways to refer to the Quit Line. The patient can use self-referral by calling the Quit Line at 1-800-QUIT-NOW or going online to pa.quitlogics.org and completing the enrollment process. The professional can use e-referral, which is available to healthcare systems or subsystems. E-referral would involve linking up the health system's EMR with the QuitLogics website. The professional can refer in-office using either fax to quit or online entry via QuitLogics. We encourage individuals who have internet access to use QuitLogics as a form of referral. QuitLogics is the online referral site for the Pennsylvania Free Quit Line, where you can refer patients who are NRT eligible. NRT ineligibility consists of the following contraindications: pregnant and/or breastfeeding women, individuals with high blood pressure and/or heart disease. Tobacco users who are ineligible for NRT due to contraindications must be referred via the fax to quit method to ensure a physician signs an approval for the NRT. We will now go through QuitLogics step by step. Healthcare provider and non-healthcare professional referral through the Pennsylvania QuitLogics website. Healthcare providers and non-healthcare professionals that are part of a HIPAA-covered entity can refer patients who have no contraindications for using NRT. They will receive status notifications when the patient has enrolled and whether they received NRT. NRT ineligibility consists of the following contraindications: pregnant and/or breastfeeding women, individuals with high blood pressure and/or heart disease. Tobacco users who are ineligible for NRT due to contraindications must be referred via the fax to quit method to ensure a physician signs an approval for the NRT. The Healthcare Provider section of Pennsylvania QuitLogics provides guidance on how to talk with patients and includes a demonstration video using the AAR model of brief intervention. To refer tobacco users via Pennsylvania QuitLogics, log on to pa.quitlogics.org. First, click on Healthcare Provider. Then, click on the How to Refer Patients box. On the next page, click on Provider Web Referral. Next, fill in Patient Information section in the upper portion of the page, then fill in Clinic Information in the lower portion of the page. Click on the Authorization box to indicate that the tobacco user has given permission for the referral to the Pennsylvania Free Quit Line and the sharing of his or her personal health information for cessation purposes. Finally, click on Submit. The tobacco user will receive a call from the Quit Line to begin the coaching process within 24 to 48 hours of online registration. QuitLogic's web referral is beneficial for a referring party who has online access. QuitLogic's web referral offers the referring party two options. 1. Complete the provider referral and receive follow-up reports, or 2. Request the tobacco user to self-register during the visit to ensure the individual successfully registers. QuitLogic's web referral eliminates the risk of the fax not reaching the Quit Line or the handwriting being illegible on the form. Now that we have reviewed the various referral methods and how to present them to your patients, we will again test your knowledge. How many coaching sessions are offered by the Pennsylvania Free Quit Line? The answer is that there are 5 coaching sessions by phone. The frequency, call dates, and times are coordinated by the coach and participant. The Pennsylvania Free Quit Line has a specific pregnancy and postpartum protocol available. To be eligible for this program, the participant must be a current resident of Pennsylvania and currently pregnant. A patient cannot enroll in the program if she is postpartum. After the first coaching call, a rewards card with a $5 credit will be sent to the participant. She will receive $5 per completed call during pregnancy, with a limit of $25, and will receive $10 per completed postpartum call, with a limit of $40. Incentives to participants are based on completed calls during pregnancy and postpartum. The caller is welcome to the program. The QuitLine customer service representative completes the intake questions derived from North American QuitLine Consortium's minimal data set and client-specified questions with the caller. The intake questions cover the following areas: reasons for calling and awareness of QuitLine, assessment for types of tobacco use, caller characteristics, other intake data, client-specific questions. Medical screening of the caller is conducted to determine any potential contraindications for any nicotine replacement therapy products offered. A welcome packet, including a welcome letter, a brochure, pregnancy information, and a privacy statement, is sent to the participant. The participant is transferred to a pregnancy quitline coach for a coaching call, or an appointment is scheduled for a coaching call in the near future at a time that is convenient for the participant. The caller is given an explanation of the available pregnancy program and the option to enroll or not. If the caller is enrolled in the program, she will be assigned a designated pregnancy coach. The participant will have the opportunity to receive text messages to her cell phone postpartum. The coach will record the participant's due date and begin the coaching process. Pending medical consent, pregnant participants may receive NRT. The reward process for completed calls begins with a $5 reward per completed call during pregnancy, up to $25. Coaching continues through pregnancy and resumes 2 weeks postpartum. Postpartum process. 2 weeks prior to the due date, the coach will either send a text message or call the participant. If necessary, the coach will discuss relapse prevention and ask the participant's doctor for NRT consent. If the participant continues using tobacco, she may be eligible for additional NRT, depending on client offerings. This will require a new medical consent if the participant is nursing. Coaching calls will resume at 2-week intervals. Reminder text messages will be sent prior to each phone call if the participant opted to receive them. The rewards process for postpartum completed calls begins with a $10 reward per completed postpartum call, up to $40. The coach will make 2 additional attempts, for a total of 5 attempts, to contact a participant who has been unreachable. Now that we have discussed the Pennsylvania Free Quitline Pregnancy and Postpartum Protocol, let's see if you can answer this question. What are the incentives offered by the Pennsylvania Free Quitline for pregnant and postpartum women? The answer is that after the first coaching call, a rewards card with a $5 credit will be sent to the participant. Receives $5 per completed call during pregnancy with a limit of $25. Receives $10 per completed postpartum call with a limit of $40. Incentives to participants based on completed calls during pregnancy and postpartum. We will now review some of the additional resources that are available. The American Lung Association in Pennsylvania has a lot of resources available that help promote various cessation programs. On this slide are examples of materials that we have available from the CDC TIPS campaign. These materials promote the Pennsylvania Free Quitline. We also have a pregnancy flyer and packet that promote the incentive program that the Pennsylvania Free Quitline offers to pregnant women. These resources are offered in both English and Spanish. Contact us today to place an order and have these materials shipped to your location. For more resources, visit the Pennsylvania Department of Health Tobacco Prevention webpage and click on Pennsylvania Free Quitline for more information. If you have additional questions or need any of the resources that were discussed in today's training, please contact our regional staff. Thank you.